Sorry about that. How's that? Can everybody hear me okay?
Yes.
So I have a little bit of a cold, so if at any point you can't hear me, someone just start waving their hands frantically and I'll assume that you just can't hear me and it's not that there's a fire or something else. So exercise and pain management are two hot topics for us here in the clinic as physical therapists, but pain management in particular has been coming up a lot in the news recently, and the new CDC guidelines for opioids and pain management and all that stuff, so we decided that we would kind of put the two together as they're kind of, in a way, they're sort of our bread and butter around here in the clinic. So I just want to give you a little introduction to some of the differences in acute versus chronic pain, sort of a new injury versus an old injury, and what the role of physical therapy is in managing those conditions. So acute pain is something that has a recent onset, and there isn't really a great window of time that we would consider acute, whether it may be a couple hours, maybe a day. The CDC guidelines kind of make that cutoff kind of below 3 months, so less than 3 months after the injury, they would consider that acute. I think for me as a physical therapist, I generally think of something as an acute injury for the first few weeks, and then it sort of gets into this gray area of kind of a subacute injury, so there's still a little bit of inflammation going on, but I may start to treat that condition a little bit differently before it transitions into more of a long-term problem. It's usually in response to a change in activity. So this time of year, lots of people are out stacking wood, or they're moving wood to their house from their garage. Those types of activities, you're taking down the garden, you're putting the lawn furniture away, and you spend about 6 hours on a Saturday working your tail off so that you can watch football on Sunday. And Sunday morning you wake up and you can't get down the stairs, you can't get out of bed, you can't put your socks on, because you just overdid it the day before. So to me, that is an acute injury. And it's usually in response to some kind of overload. So those activities in isolation probably all would have been fine. They probably would have been fine for 2 hours of those activities. But when you stretch it out to 5, 6, 7 hours, which is a common complaint we have here in the clinic this week in particular, that would just kind of set things off. So I would consider that an acute injury. Generally, also with an acute injury, the area is pretty local. You know, my back hurts and it's right here, or I twisted my knee because I stepped in a hole. My pain is at my knee. And it's pretty easy to localize that pain. Maybe it's not a pinpoint pain, but it's pretty local to a small area. So chronic pain is a little bit different. So then we get into that kind of 3-month window cutoff. And that's what the CDC would consider your transition into chronic pain. The pain becomes less specific. So over time, it starts in that one place, but it starts to spread out. And that's one of the things that we really see as physical therapists quite commonly is someone has a knee injury, and then it sort of turns into like this knee ankle, knee hip thing. And then it's kind of the whole left, it's like here, just this general area. It's my whole left side. My whole left side's been a mess for 10 years. So we hear things like that a lot, especially with these more chronic conditions. One of the things that also happens when something is more chronic is that the response to stimulus changes. So things that are normally maybe a little bit painful are more painful than they used to be. And something that maybe was something that wouldn't have given you any pain in the past, now is painful. So we would consider those noxious and what would normally be sort of a non-noxious stimulus. Both of those start to become more sensitive. And as the intensity and the duration of pain increases, generally so does that hypersensitivity. So, and at this point, because the symptoms have sort of spread out a little bit from that first site, you start to involve other systems. Your neurological system is certainly one of the ones that's most involved along with your musculoskeletal system. But if you think about what some of the changes that happen when you have an injury, you start to slow down a little bit. Maybe not a ton, but you go, well, I'll take it easy for a couple of weeks so that this can calm down. And those couple of weeks, it's still bothering you, and you stretch that out a little longer. You're still kind of taking it easy. So then other systems start to become involved also. The endocrine system is actually another one that sees some changes, and there's some hormonal changes that are involved as you make that transition into chronic pain. And that can impact your exercise level activities, sometimes your response to medications, and a variety of other factors kind of come into play there. So this is the reason we're talking about chronic pain, and pain in general. As physical therapists, pain is the #1 complaint we see in the clinic. So if you were to come up to me on the street and say, Kate, man, I've got back pain, is that normal? Well, as a physical therapist, to me, everybody has pain, because everyone who walked through my door today has some kind of complaint of pain. So to me, it's a pretty normal thing for someone to come in. You know, you have some aches and pains here and there, but it's a huge cost for us as a society. And it's a huge health problem for us as a society. And it's starting, I mean, that number just keeps getting higher and higher and higher. So with chronic pain in itself is kind of this ambiguous thing that people talk about. It's not very well treated in medicine and by physical therapists in general. I'd say we don't do a great job treating chronic pain. It's something we're trying to get much better at. And that's because things start to change and things become less specific. So once we move away from that, ow, I hurt my knee, and things get a little bit more broad, it's hard for us sometimes to wrap our heads around what's going on and look at the person as a whole. Now, one of the things, for example, that changes is that your nervous system starts to kind of reorganize, and pain becomes a normal thing to your body. And that's just kind of the day-to-day. These pathways that are coming up and down your nervous system, they start to change. So your body's response to pain and to those stimuli we talked about a minute ago, that will also start to change. As your symptoms go on for a longer period, like I said before, there's increased sensitivity, and then they're just going to kind of broaden a little bit. And the next slide will really kind of give you a better idea of that. Now, what I spoke to before with that kind of sensitivity to different stimuli, that sort of has an additive effect. And I liken it to turning up the dial on the TV. Not that anyone has a dial on their TV anymore, but you probably know what I mean. So, you would turn that knob that was on the TV, and as somebody comes along and you're getting poked by whatever it is that's bothering you, instead of the volume level staying here, that starts to turn up. It starts to add up over time. It's sort of like that little kid who stands next to their mom and says, Mom, 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 over and over and over. Probably the first 20 times it wasn't too big a deal, but after 2 minutes of your kid saying that over and over, you're probably about up to here at that point. And it's the same thing that happens with pain. And one of the interesting things, and I was just speaking with someone about this recently, is that the level of pain that someone experiences is not directly correlated to the amount of tissue damage in the initial injury. So someone who says, I just sprained my ankle, and then 6 weeks, 8 weeks, 10 weeks, 12 weeks go along, and they haven't taken care of that ankle, or maybe that pain is still kicking around. 5 months later, their pain is much higher sometimes than it was at the initial injury for just an ankle sprain. And at that point, their function starts to really diminish. So this is that time-dependent pain phenomenon where it begins to spread out. And notice that the intensity doesn't necessarily increase according to this graphic, but it's broadening. And that's where it really starts to become a difficult thing for us to treat as medical practitioners and as physical therapists. So I talked about that nervous system. And I'm sure we've all complained about something in our lives, and someone has said, well, it's all in your head. Because that spreading out of the symptoms makes it so broad that it's hard for us sometimes to wrap our heads around it. So it's not really all in your head, but because of those changes that happen, those adaptations, it's really just settling into your nervous system. And that's because you have all of those changes. So those changes in response to the stimulus, it's actually impacted greatly by environment and your stress level. So if your stress level is here, and I'm sure plenty of people in here can say this, if you have back pain and your stress level is way up because it's the holidays, there's family coming into town, you've got to do all kinds of cooking, and the house is a mess, and the dog's running around like a maniac, that back pain gets a whole lot worse all of a sudden. Or if you have other medical diagnoses or procedures that are sort of coming to a head, or you have a family member who's not doing well, all of those things somehow seem to elevate your pain level, even if your activity level doesn't change. Hot and cold are big factors. This time of year, when I have folks who have back pain when they're going to watch their kids go, or their grandkids go play football, got some big games coming up in this area, and it's cold and it's rainy, I tell them, make sure you really stay warm, because as you're shivering and you're tensing up, it's not just your muscles that are getting more sore, but that tensing up is stirring up your neuromuscular system, and that's going to stir up your pain level, so you want to stay warm. Noise is another one. Just like if you've ever experienced a migraine headache, you get that sensitivity to noise, that's your neurological system ramping up and making you more sensitive. Sometimes it can even be impacted by totally unrelated conditions, so that's where those medical diagnoses come in. And in this case, when you get into the nervous system, it's going to respond a little bit differently than typical medication. So from a physical therapy standpoint, of course, our bread and butter around the clinic here is exercise. We want everyone to exercise. We want everyone to be well. But there are some guidelines to follow when you're in these different phases of injury. So in the acute phase, these are the things that we kind of think of. So everyone says, so do I do the RICE thing, which is RICE, ice, rest, ice, compression, elevation. That comes up all the time. So we'll talk a little bit about that. And my favorite, well, this is a no pain, no gain thing, right? I mean, I hurt my knee back in football like 25 years ago. I just pushed through it and I was fine. So we'll kind of touch on those things a little bit. So in the acute phase, relative rest is best. So what I mean by that is you want to stick to as much pain-free activity as you can. Because as most of you probably know, if you don't move it, you lose it. Well, if you rest for more than a few days and you're lying about on the couch, everything else starts to slow down, and then you have to get all of that back as you get back to your regular activities. So for someone who injures their shoulder, or perhaps they injure their back, if they're comfortable going out and going for a walk or going for a nice hike, yes, you should absolutely be doing that as long as it's not significantly inflaming that injury that you just gave yourself. No pain, no gain does not apply in the acute phase of an injury. That's the time where you want that injury to rest. It's an inflammatory condition oftentimes. The inflammation needs to go down so that your body can recover, and then you can move forward more quickly at that point. If you just keep plugging along and just irritating that, it really prolongs that acute phase, and then you don't get over the injury as quickly. You lose out on time and activities that you would like to get to. As physical therapists, we like to preserve your overall mobility. So if you injure your back, you're darn sure we should be looking at your hips and your knees and your ankles and everywhere else to make sure that you're not losing anything anywhere else that then becomes a problem or becomes a bigger role or plays a bigger role in your low back longer term. And then we're going to try and preserve your overall strength. So ice and pain relief. A lot of people go to kind of the ice and the heat thing first, which is always, to me, that's a great thing. So ice is often indicated in that acute phase. In the literature, if you look into the medical literature, its impact on swelling is a little uncertain. It's kind of a gray area. We're not really sure if it really pulls all that swelling out of there, but usually when we're icing, we're also elevating and we're resting for a period. So it's probably a combination of factors that helps to reduce that. But either way, that ice is going to take you off your feet for about maybe 15 or 20 minutes and give your body a little break, which right there you get back to that rest thing, so that's important. It's important to take medication as prescribed by your medical team. And people always come in and they go, I don't know if I should take this, or I should take that, or I should take this. You need to speak with your primary care provider around that and make sure that you're taking something that will be helpful for your injury and is not going to impact your other systems or other medications you may be taking. There could be some interaction there. So we always defer to your primary care provider on that. One of the things that comes up oftentimes, especially now, we talk a lot about the opioid problem across the U.S. and certainly in this area. So the CDC just came out with their new guidelines for medication, and their thought is that the lowest effective dose of an opioid for a short-term period is okay in the acute phase, but it should be a really short-term period. So they don't want somebody handing you a bottle of 60 pills and saying, for your ankle sprain, and saying, okay, there you go, give me a call if you have a problem. Their recommendation is that it really needs to be a very short window. But again, it's about talking with your medical practitioner and not just taking something out of the cabinet that you had when you got your tooth extracted 2 years ago. That comes up a lot too. So again, the compression and the elevation is great. We like to recommend that people use a compression sleeve or a garment with the elevation. Again, if you're doing the elevation and the compression and the ice, most likely that's going to help to reduce your swelling. Swelling is normal, and that's important after an injury. And it's just part of the healing progress. Part of the problem with swelling is that if we don't get rid of that swelling in a timely fashion, it's going to limit your range of motion. It will limit your muscle function because interestingly, swelling actually inhibits your muscle's ability to activate and to fire properly. And it can be kind of hard to move it away from some of your peripheral joints. So if it's in your ankle, or it's in your wrist, or it's in your hand, it can be really hard to get it out of there. So we like people to jump on that right away and try and get that moving so it doesn't start to settle anywhere. One of the best ways to get rid of swelling is actually to just get early, comfortable movement going on through the joints. And that's because your muscles act like a pump to push some of that swelling out. So as long as the activity is comfortable, that's a good thing for you to do. So physical therapy in the acute stage, we'll focus on pain reduction. Manual therapy is one of the big things we'll go after, so we'll do some things to reduce swelling. We might get in and kind of get some joints moving and help you get some stretching going. We may use some physical agents like electronic or electrical stimulation. Maybe we'll get some ice going. And we basically want to just restore your mobility and strength, get you safely moving so that you're not going to injure that area further as you're moving along. So here's some interesting statistics. So a lot of work has been done in the cost-saving ends of things in the medical literature recently, certainly in the physical therapy and the back pain literature. So if you hurt your low back, starting PT first, on average, will save you $2,700 in medical expenses from this study back in 2012. Here's an interesting one, because oftentimes people hurt their back and they say, oh, I think I herniated my disc. I should probably get an MRI because I hear that that's going to tell me what happened. Well, the cost savings can really be a big deal, especially with these high deductibles a lot of us are paying now. So aside from getting moving more quickly, there's a cost savings to just getting things going a little bit sooner. So you can come in and see your physical therapist early on. So in the chronic stage of things, exercise can be difficult, again, because you have this widespread pain going on. So we need to remember that the pain is going to be less local. It may be a little bit more intense than the original injury. But the pain itself is less associated with that original injury, because if you think about it, if I sprained my ankle 4 months ago, that should have healed by now. You know, why is that still bugging me? So again, it starts to become a little bit gray. It'll be time dependent, and again, like I said before, it's going to involve multiple body systems. And because the pain involves all of those systems, everyone experiences it a little bit differently. My 8 out of 10 pain is not the same as your 8 out of 10 pain, or your 2 out of 10 pain. It's definitely not your 2 out of 10 pain. It's not the same as someone else's in the back. Everyone is different. Everyone's experience is a little bit different. And it's something that we need to keep in mind as physical therapists as we help to move you through this progression. So as PTs, when you have more chronic pain, we're not just going to go in and look at your knee. We need to think about things that are also affecting your ability to cope, your ability to get over the injury and move forward so you can get back to the things you enjoy. So we want to kind of take a whole body approach to this. We want to find out, well, what's your attitude? What's your attitude about your pain? Do you have a negative attitude about your pain? Most people do, because pain is an unpleasant experience. But it's still your body, and we need to help you work with your body to get a more positive outcome. We're going to ask you to kind of find out about your beliefs about your pain. We're going to find out about your environment, the stressors in your life, any other health conditions you have, what particular physical limitations you have because of your pain or because of other conditions. And one of the big ones is a lot of people are very fearful of their pain, especially if they've had really intense pain for a long time. They don't know what they can do to move themselves forward safely because, let's face it, you don't want to put yourself in more pain. You don't want to do something today that means that you'll lose 3 more days of activity because you paid for it. So we're going to try and help guide you through that process. From a physical therapy standpoint, we'll work to address your mobility and your strength deficits. And those are kind of the things people think about when they think of physical therapy. Okay, we'll do some stretching and some range of motion, we'll do some strengthening exercises. And then the other thing that we like to do is we like to take a look at how your whole body moves. Particularly when we're talking about someone with low back pain, and they say, oh man, every time I go to lift something up, it really bothers my back. And I'm going to say, you know what, we're going to take a look at that, we're going to see how you're moving, and see if we can tweak that a little bit to make it more comfortable, because you need to be able to pick things up from the floor. You need to be able to lift your groceries. So we're going to go in and we're going to address some of those faulty movement patterns to get you back to activity. So it's really important in physical therapy that we spend a lot of time in planning and education when you have a more chronic condition. We want everything to be very specific to you, because your pain is your experience and your condition, it's your body. So the instruction and exercise is specific to you. We want to take into consideration, again, your whole body, your whole system, other medical diagnoses. It's really important as a patient or as a consumer that you let your practitioner know what your goal is. Because if you just come in and you say, I just don't have any pain anymore, well, that's great. That seems like a pretty lofty goal, but it's a good one. I like that goal. But what do you want to do? What is the pain limiting you with? What can't you do that you would like to do? Those are things that are important to me to help guide you to make sure that we get you back to where you want to be. Because if you don't want to be able to squat 150 pounds on your back, then we don't need to focus on that. That seems like a silly thing to focus on. And I need to, as a physical therapist, take into consideration the other environmental factors. If you say, you know, I went to physical therapy and they gave me 20 exercises to do 3 times a day, and you know, I just really couldn't get to them, let's be honest, I'll say, okay, well, we need to take that into consideration. What works for you? How about if you have 3 exercises to do once a day to loosen yourself up, and maybe some strengthening exercises across the week? Is that something that works? So we need to take those factors into account too to help you be more successful with your own management. So in the chronic phase, no pain, no gain also comes up again. So that kind of depends. And again, it's a gray area. So for people who have pain and have, particularly if they have resting pain, we want to get you moving, we want you exercising, because that's going to help overall to decrease your pain. But we need to be aware of kind of a threshold. So activity pacing is number 1. Remember those 7, 8 hours of yard work I talked about earlier? Well, what if we had just done, okay, well, you know what, you can go out and you can rake leaves, but I want you to rake leaves for an hour, then go in the house, take a break for 20 minutes, half an hour, then go back to the raking the leaves, and break it up a little bit, because that could be the difference, giving your body a rest. That can be the difference between you getting a bunch of work done and having a pretty good day the next day and be able to maybe do a little bit more work, or doing a bunch of work continuously for 7 or 8 hours and then being down for the count for the next 5 days. So that's something that's very important. Exercise dosage is important. So if I said to you, okay, you have a headache, you go into your medicine cabinet and you're going to get some Motrin, some ibuprofen. You're not going to reach into that medicine cabinet, open the bottle, and just down the entire bottle of Motrin, because we all know that that's a really bad idea, right? But exercise and activity are exactly the same. You need to take them and you think of it as like a dosage. So for me, if I haven't exercised in a long time, it's not a good idea for me to start training for the Chad half marathon 2 weeks in advance. So if I've got to run 13 miles for the Chad, and I haven't run in a year and a half, starting that 2 weeks in advance, that's a big exercise dosage over that time period. So I need to be aware of that in my planning. From a pain standpoint, I usually talk to people about the relative change in their pain. So it's not, well, do you have pain while we're doing this exercise? It may be, okay, is this a lot more than your resting pain? Let's kind of find a happy spot in here where maybe the pain goes up a little bit, but you know your pain, you know that it's not going to increase that over the next few days. So we have to kind of talk back and forth and get an idea for where we're going with that. So there's some benefits versus relative risk. And what I always tell people from a physical therapy standpoint, your biggest risk is that you're going to be a little sore tomorrow. If you already have pain, you're used to being sore tomorrow. But we need to kind of find a happy medium there where, again, we're not setting you back too far. And then as all of you, I'm sure know, side effects of medication are more system-wide. And they can affect various systems within your body, and they pose a longer-term great risk. So from a physical therapy standpoint, to me, that seems like a win-win. So one of the conversations I often have as a physical therapist is people say to me, all right, Kate, this all sounds great, but I've done PT before. I've been here, I've seen this person and that person, they're all experts, all of you guys are all educated. It hasn't worked. Well, these are kind of my rules for when you're seeking physical therapy. One thing I always tell people, just like not all dentists the same, not all car mechanics are the same, not all physicians are the same, not all physical therapists and not all physical therapy is the same. So you need to do your research, you need to ask your friends, you need to ask your family, do some research online. Doing your homework is really the biggest thing I can say to people when you're looking for a physical therapist to treat your condition, particularly when you're talking about something more chronic. Speak with your healthcare team. Who do they recommend? And ask them why. Well, why do you recommend them? Do you have a relationship with them? Have you sent other patients to this physical therapist before for a similar condition? Did they have good outcomes? So you want to ask some questions. Just like when you're buying a car, you should really shop around. If you go to a physical therapist and you don't make a connection with them, especially when you're dealing with something that's really impacting your life, go see someone else. Or if it's a good sized practice, say, you know what, you were really great, but can I see one of your other team members and see what they have to offer as well? No, I don't think anyone would be offended by that. It's all about you. It's not about us. Make sure, like I said earlier on, make sure your goals are known. If you want to be able to pick up your granddaughter from the floor so that you can scoop her up and give her a hug when she needs it, well, that's a pretty good goal, but I need to know that that's what you want to do. And then the other thing, which is a huge stressor in medical care these days, is just understand your options. Understand your insurance. What are your benefits? What are your out-of-pocket expenses? And if the cost of it seems like it's a hindrance for you getting care, when you call an office, you should ask about things like payment options and that sort of thing. But you want to be educated as to what you have in your pocket when you go in somewhere so that you're not hit 2 weeks later with a big bill and you add that stress onto your life. So it's important to understand those things before you go into a physical therapy environment to just make your experience a little better overall. Now, does anyone have any questions for me? Anything for the presentation or any other general pain questions? Yes?
Can you talk a little bit about inflammation? What it is, where it comes from, what its role is? And you talked about it a lot under acute pain, but I'm just kind of curious about that.
So more chronic inflammation?
Yeah, either one.
Okay.
What is it?
Sure. So acute and chronic inflammation are both.
What was the question?
Oh, sorry about that. So the question was, just to talk a little bit more about inflammation and what that is. So inflammation is the body's response to some kind of insult or injury. So there are a lot of changes that happen on a cellular level. Basically, your body sends all the troops to that spot to try and heal something as quickly as possible. So you can think of it as you cut your arm, and then over time, over the next few days, that's going to heal up and develop a scar. Your body just sends everybody in to fix that one thing. Now, in an acute inflammatory stage, the cellular processes that happen are actually very different from a more chronic inflammation. And when chronic inflammation, we sometimes start to actually see breakdown of certain tissues. So, and that's part of the reason you treat something that's more acute differently than you would something that's more chronic. And that's also why they often respond very differently to medications, because there are just different processes happening at that point. Does anyone else have any questions for me?
Yeah, so how is it true that you need to take a lot of ibuprofen to get the inflammation down? Because I was a little bit shocked how much they prescribed, and So, because for pain itself, maybe one is enough, but then I heard or read somewhere that you need to take more to really get inflammation out. Is that true or not?
Well, the therapeutic dosage for ibuprofen,
It's individualized.
it's very individualized.
Could be tiny, could be more.
So as a physical therapist, I don't make any particular recommendations for medication, even over the counter. That's a little out of my scope of practice. But it is very individualized based on your size, your body system, what other medications you're taking, and the process that's going on. So that's something you always want to just defer to your healthcare provider, your primary care provider.
Can you treat when arthritis? How do you know when something's chronic pain and something is arthritis?
Well, that's a tricky question. So the question is, when do you know something's chronic pain versus arthritis? And arthritis is a chronic, ongoing condition. It's funny, they kind of overlap a lot for a lot of folks. So we may treat them very similarly. See, everyone has a little bit of a different reaction to their condition. So not everyone gets into this sort of chronic pain state where things start to spread out and the things become more sensitized. That's some people, but other people would say an arthritic condition, their pain is right there in that arthritic joint, and there may be some of those kind of sensitivity changes, but that doesn't necessarily become this big phenomenon for everyone. So again, it's very individualized from that standpoint. So as a practitioner, I need to kind of do my homework and ask the right questions so I can get a better idea as to what type of process is going on. Does that make sense? Was that a non-answer to your answer?
Well, can you treat arthritis?
Oh, absolutely. So from a physical therapy standpoint, so the follow-up question was, can you treat arthritis? So I'm not necessarily treating that arthritic condition within the joint, but one of the main things that happens with arthritis is because you have pain, the muscles begin to lose their function, and your muscles in particular are like shock absorbers for your joint. So while you may have some deterioration of the joint cartilage and things start to break down in there and you get those little bony osteophytes that you hear osteophyte, you go, ooh, what's that? You know, everyone starts to worry about that, but if you can strengthen the muscles in the area around that joint and some of the more remote joints, that helps to absorb the shock and sort of attenuate the forces around that joint so it becomes less symptomatic.
Are there foods that aggravate inflammation and conversely reduce inflammation?
There are, the question is, are there foods that aggravate inflammation and some that help to reduce it? There are. I'm not a nutrition expert, but just from my experience and my reading, the more sugary, higher sugar, longer processing foods tend to aggravate inflammation, for sure. There's a lot of information now on the internet about that, but that's something that you would certainly want to consult with your physician or a nutrition counselor to get some really good information on that. Because there are some, I've had some folks come in that have been on some pretty successful diet and eating plans to help with their inflammation, especially in conditions like rheumatoid arthritis or osteoarthritis.
Just to kind of build on your question, at our last speaker series, we actually did have a nutritionist speak about some of that topic. Excuse me. So if you're interested, on our YouTube page, we have the recording, just like tonight we'll be recording this one, and it goes into some of those things. So if you go to YouTube, so just youtube.com, and in the search bar type in Cioffredi, it'll pop up our channel and you'll be able to find it. I believe the title is Foods After 50, and it does go into foods and diets for when someone is looking at arthritic conditions. Thanks, Kate.
Any other questions before I turn it over?
Were you going to talk about walking? I thought that was the title.
That was my husband's catchy title. Came up with that one. So it's really that exercise piece, how to get back into exercise. Walking is almost always a great thing.
Great.
So I'll be floating around the rest of the evening, so if anyone thinks of anything while Dr. Schwartz is speaking, please feel free to catch up with me afterward, and we can stand around and chit-chat for a bit. And Bill, you turn it over to Bill.